Hi, good morning. I'm Vikas Rathi. I'm cardiologist at Bon Secours.
And I'm Shakil Khan, also cardiologist at Bon Secours as well at St. Francis. And welcome today to Facebook Live. Thank you for logging in. We'll cover cardiology in general, but I do want to start off by talking about hypertension, high blood pressure. There were some new guidelines published last year by the American College of Cardiology, and it is a change from prior guidelines in that the goals for blood pressure are lower than they have been in the past. So I do want to go over that a little for a few minutes as we get started here. So hypertension or high blood pressure is called the silent killer because a lot of people have it and don't even know they have it. Hypertension is very common. A third of all people have hypertension, and people have about an 80% chance of having high blood pressure at some point in their life as they get older. It increases the risk of heart attacks, kidney problems, stroke, heart failure, and controlling blood pressure lowers those risks. So it's really important to find out if you have high blood pressure, and if you have it, control it. There are several risk factors for getting high blood pressure. The most common thing is probably diet, a diet high in salt, low in potassium, also a sedentary lifestyle, alcohol, obesity, sleep apnea, smoking, diabetes. These all things are reversible risk factors that cause hypertension. And there are things you can change, like your age or genetics. So there are a lot of causes for high blood pressure. A lot of people have it. It leads to a lot of problems. So it's really important that we find out if we have high blood pressure and then control it. So the ACC, in order to help lower risk of heart problems in the country, has published new guidelines, and they've discovered that aiming for a lower goal would be better than prior guidelines. And I'll kind of show this briefly up here. I know it's kind of probably hard to see, but normal blood pressure is less than 120/80, and elevated now is a systolic of 120 to 129, with the diastolic less than 80, and stage 1 hypertension is 130 to 139. Stage 2 is 140 or greater. So these numbers for stage 1 and stage 2 hypertension are a little lower than they have been in the past. And the goal for the country is to try and get everyone, if feasible, under a blood pressure less than 130/80. Dr. Rathi, what do you think about the hypertension guidelines?
Yeah, I think these are very welcome guidelines. It's been about 15 years since these were updated, and these were updated based on the recent research which has come out in terms of the threshold of blood pressure, which we used to consider that was probably normal. Even in that threshold, people were having events, particularly heart attack or stroke. So the premise of the guidelines are to reduce the burden of high blood pressure by reducing the level of the blood pressure which we were targeting, and also to have increased education in terms of why blood pressure is happening, what are the reasons, and how we can prevent it and treat it. I think one of the key factors which Dr. Khan pointed out was that 80% of the population in advanced age, more than 60 years, 70 years of age, will have some level of high blood pressure, whether it is just elevated blood pressure by the guidelines, which is 120 to 130 systolic blood pressure, or stage 1, which is greater than 130, and stage 2, which is greater than 140. The key thing to remember is, as we all get into the age group greater than 40 or 45, about 95% of the African American population, or blacks, will have chances of high blood pressure. And so the ethnic group is also very important as we look across the board. And the second group, which has high incidence of high blood pressure, which is about 80 to 90% of Hispanics, would have high chances of having high blood pressure. And about 70 to 80% of whites would have high chance of high blood pressure beyond the age of 45. So when to check, I think it's a good timing in terms of the age group. If you're in 40 or 45 years or beyond, we should be regularly checking our blood pressure and keeping in mind that the blood pressure should be less than 120, which is the top number, systolic, and less than 80, which is the bottom number, called diastolic.
Yeah. So one thing people ask me a lot of times is, how do I check my blood pressure at home? So home blood pressure monitoring is important, and it adds to the number information we get in a doctor's office. So people could be high in the office but okay at home, which is kind of white coat hypertension, or they could be okay in the office but high at home, which is masked hypertension. And so getting home measurements is really important. And one thing people ask me all the time is, how do I check my blood pressure at home? When do I check it? So I'll just read to you what the guidelines have laid out, which I think is really nice and makes it very simple. So one thing to remember is make sure there's no smoking or caffeinated beverages 30 minutes before you check your blood pressure. Sit down, be quiet, rest 5 minutes before you check the blood pressure. Sit with your back straight on a chair and legs flat, feet flat, and legs uncrossed. And after that, take 2 readings, as the guidelines say, a minute apart in the morning before taking your medications, and then again in the evening before supper. And then keep a track of these readings, so when you see your doctor, you can show them either the monitor or a list of the readings. And that is very helpful information for me to see what to do for the patient to treat them.
Yeah, I absolutely agree. I think keeping a list of blood pressure readings not only helps you understand, where your blood pressure is, but also taking that list to the physician office will help physicians to know what times of the day the blood pressure is higher, what activities you were doing, what is your trend of blood pressure. Is it just 1 or 2 times you had high blood pressure? Maybe there was some event which was happening, whether it was something going on in your life. We can probe those areas and probe with some questions, knowing what exactly is going on. Yes, we are focused on the blood pressure, but what is causing that blood pressure is also important, whether it is the life stressors, whether it is just that your blood pressure is varying significantly, or is it related to some medications. So those are really important. So definitely bring a list of blood pressure readings from home, whether you're newly diagnosed or whether you already have blood pressure and you're on blood pressure medications. It's always a good habit to keep a tally of blood pressure readings. So on the same topic, Dr. Khan, would you like to go over as to how to prevent or treat blood pressure without medication?
Sure. So there are a lot of medication for blood pressure, but before we go there, we want to make sure we have a good, healthy lifestyle. And the non-medicine approaches are the most important approaches. And that should be done before we start medications in many cases. So things that are important to help prevent and treat blood pressure is weight loss. So for every kilogram of weight loss, there should be 1 millimeter drop in systolic blood pressure. So 5 kilogram weight loss will lead to a 5 millimeter drop in blood pressure, for example. A healthy diet. So the DASH diet is what's recommended as one diet to help lower blood pressure. And this is a diet that's rich in fruits, vegetables, whole grains, low-fat dairy products, and reduced saturated and total fat. Low sodium intake is an important thing as well. And by the way, the DASH diet can lower blood pressure on average about 11 millimeters of mercury. So that has a very robust benefit. Low sodium, the goal is under 1,500 milligrams per day for most adults. Even lower will be better. Increased dietary potassium. So as long as you have normal kidney function, increasing potassium in your diet helps lower blood pressure as well by 5 millimeters of mercury. And so the aim is for 3,500 to 5,000 milligrams daily of dietary potassium, foods rich in potassium. Physical activity is important. Exercising aerobic 30 minutes a day, 5 days a week is the goal. Doing dynamic resistance exercises as well. A little bit of weightlifting, low level is helpful. And reducing alcohol intake. So alcohol, less than 2 drinks for a man and 1 drink for a woman is recommended to help control blood pressure as well.
We have a question from somebody watching. Bobby Hill asks, are blood pressure readings on electronic machines generally higher than taking blood pressure readings manually?
Yeah. Good question. Actually, I think looking at the data from before, they're a little bit lower at home. You take it at home compared to when it's in the doctor's office, done manually. And for the cuff, it should be a right-sized cuff, and it should be an upper arm cuff is what I recommend for most people to be most accurate. And the size of the cuff is really important. So if you're a large sized person, it should be a larger sized cuff.
Just to add to that, I agree with that. The cuff size is important. Many times, if you don't know exactly what cuff size will fit you, also look at, there's tie cuffs which are available. So if you're a larger person, then ask for a tie cuff and use that on the arm. Oftentimes what I've come across in patients is it's difficult to put the cuff on the arm, and that's fine, arm is preferred, but if that is the case, that there's difficulty in putting the cuff on the arm, you can get a wrist cuff, which are generally gives a good reading. At least it's a good start to know what the blood pressure is. The key things are also to make sure that the batteries are new and at least are not discharging, because when the batteries are at the end of the life, they can give you erroneous blood pressure readings, sometimes very low, sometimes very high. So regularly change batteries every 1 to 2 years, or whatever the recommendation from the manufacturer of the blood pressure cuff is.
Yeah. And also what I recommend my patients to do is bring your cuff with you to your doctor. So the doctor can check manual blood pressure in the office, and then you can check your cuff blood pressure and compare and how they correlate. Right. That's very helpful.
There's another question from somebody online. Jane Alford asks, what about the keto diet?
The keto diet, this is a diet high in ketones and protein. I'm not too familiar with that specific diet. Yeah.
Well, I think the key principles of any diet, for example, would be not to just focus on the diet, but also focus on other key areas of the lifestyle, which Dr. Khan pointed out is looking at the amount of exercise you're getting, the amount of activities you're doing. The sodium, really the most important factor is to reduce the salt intake. Just to give an example, how much salt we on an average eat, a slice of pizza has about on an average 300 milligrams of sodium in it. So if someone ate 3 slices of pizza, that's 900 milligrams to almost 1,000 milligrams. And considering that our limit should be less than 1,500 milligrams, that's almost, you got 2/3 of your sodium right there in 3 slices of pizza, and that's just one meal. So I think there's the important factors are any diet, but whatever diet has low sodium is the most important diet. High in fruits, high in vegetables, nuts, Mediterranean diet, any diet which is low in saturated fat will help reduce the blood pressure.
So there are a lot of diets out there besides the DASH diet and Mediterranean diet, and there are a lot of fad diets out there as well. And they may show some benefit in people losing weight initially, but they can also have long-term side effects. And so there are a lot of diets, and I would stick with what is proven to work and be safe, what the American College of Cardiology recommends. And again, Dr. Rathi was saying, high in fruits, vegetables, high fiber. I would steer my patients away from a lot of these fad diets. They may be high in fat or, just high in protein. Just follow a sensible diet.
Right.
Yeah.
So I think moving forward, we wanted to also touch base on the medications. So Dr. Khan, you have any thoughts about medications? What are the rights? To consider as the first line, second lines?
A good question. The guidelines do talk about this as well, based on data that's shown to be most beneficial. So the first line agent are drugs like thiazide diuretics, ACE inhibitors, and calcium channel blockers. And the choice, what the patient gets, depends on the patient itself. So in African Americans respond better to calcium channel blockers than ACE inhibitors, for example, better to thiazide diuretics than beta blockers. So what we choose really depends on the specific patient. But there are 3 classes of drugs that I mentioned earlier that are usually our first line, and then we go from there.
One other thing to add would be this is away from the medications, also as a risk factor. So know your family history. If you have a family history which has high incidence of high blood pressure or heart disease or stroke, then be careful in terms of your own health, because you're more than likely to get those kind of features in your own health. If you look outside from your, just like your family, more than likely you look the same from inside as well. What that means is that if you have first-degree relatives who have high blood pressure, you have a high chance of having high blood pressure as well. So genetics is really, really important, which determines, the chances of you getting high blood pressure, heart disease, or stroke. So always know what your family had and at what age they had, because more than likely there is a chance that at the same age you might get affected by that as well.
Yeah. So Bon Secours has a heart check challenge that is a tool to help you kind of figure out what your risks are and where you stand. So the heart check challenge can be done on bonsecours.com website. There are 3 parts to it. There's a free heart assessment, which is a series of questions to identify your risk of heart disease. There is a CT heart scan that's available, which is a CT scan of the chest looking for early signs of heart disease, early plaque buildup. And that's at a reduced price for this month. And also a directory for which physicians are available that can help you with your questions and problems.
So about the heart scan, many patients come and ask, Doc, why can't I get a heart scan to know do I have heart disease? So heart disease, when we speak about, is just a very broad term. Heart disease can mean one can have blockages. Heart disease can mean one can have high blood pressure, which can lead to heart disease, or people can have valve problems or certain other heart diseases like cardiomyopathy. So one particular test cannot look at all aspects of the heart disease. However, heart scan looks at plaque built up in the arteries of the heart, which is the coronary arteries. And that is the number 1 cause of heart attack. So it is an indirect sign looking at this calcium score through the heart scan, which is done non-invasively. It is a quick test. It takes literally less than 5 minutes to do the test without starting an IV, without giving any dye. And it's a very powerful test in certain patient population where if the coronary calcium score is 0, that means no plaque built up. That means the risk of having heart disease in next 5 years is very, very low. Versus if the coronary calcium score is high, depending upon their age, then that could mean a certain level of risk of heart attack or heart disease in future.
Yeah. So I think the heart scan is a great test. I recommend it quite a bit to my patients. So again, it's not for everyone, but it is for a certain group of patients, the ones we consider intermediate risk. So for example, someone who is young, under age 30, healthy, no risk factors, they're low risk for heart disease. They don't need the heart scan really, unless there's a strong family history. If you're diabetic, smoker, have vascular disease, these patients are high risk. For them, a heart scan doesn't change too much, to be honest with you, and they need to be treated aggressively anyway. Right. But the ones who are intermediate risk, with some risk factors, they're obese, sedentary, family history, the cholesterol is kind of borderline. For those patients, a heart scan can be very helpful to help guide therapy. Do we treat them aggressively as a patient with heart disease or more conservatively with medication? So the test costs $99 this month. Usually it's $129. And it really helps us kind of see how to best treat patients.
We have 2 questions here. Sandra asks, what about POTS?
Okay. POTS is what's referred as postural orthostatic tachycardia syndrome. There is a number of causes for POTS or POTS syndrome. One of the factors is autonomic dysfunction. It's a form of heart disease where the blood pressure kind of fluctuates with the position of the patient, heart rate fluctuates with the position of the patient. It's not directly related to hypertension. It's not related to, coronary artery disease. It's something which people have based on their neurogenic conditions or conditions which are affecting their control of blood pressure internally through the signal mechanisms of the blood vessels with their nervous system.
We see it quite a bit, more often in young females.
Right.
Definitely, it's something you can grow out of too after a while. I would say see your doctor to kind of look into it, see if you really have it or not. There's some tests we can do to look into it.
And the final question: is it possible that post-treatment of head and neck cancer in the area of the carotid artery that can cause high blood pressure with fibrosis?
Yeah, I guess it's...
Right. So again, I think the question is the carotid arteries, if they were either scarred or they had injury because of the surgery or radiation in the head and neck region, could they cause high blood pressure? Not directly, but again, carotid arteries are involved in the signal mechanism of the blood pressure, particularly how the blood pressure is regulated, whether a patient is laying down or sitting or standing or in certain positions. So there could be variations in the blood pressure if the carotid bulb is affected, whether it is because of the surgery or because of the radiation. Certainly it can cause problems in the regulation of the blood pressure.
Yeah, I guess it's possible. But patients who have vascular disease often have high blood pressure as well. There's a lot of risk factors that lead to the vascular disease, and high blood pressure is one of them, which they may have anyway.
Okay. One of the things which we also wanted to touch was there's a lot of risk factors, including our diet, as we went over in quite detail, but also a lot of people we have come across who have unknowingly or knowingly sleep apnea. It's becoming more of an epidemic in recent years, where more and more people have sleep apnea either because of the weight gain or the lifestyle, if there's lack of exercise or immobility or just simply obesity can cause sleep apnea. So hypertension is actually the number one cause, or sleep apnea is actually the number one cause for hypertension. So always we want our patients to be screened for sleep apnea as well. Dr. Khan, do you want to go over if there are some key points about the sleep apnea?
Yeah. So most hypertension is what we call essential hypertension. Right. This is from like diet, vascular stiffness. But when there's secondary hypertension, things that cause it specifically, sleep apnea is a very common cause for that. Mm-hmm. Along with thyroid disease, adrenal disease, kidney disease. Those are all secondary causes.
Right.
What was your question again? I'm sorry.
Well, the sleep apnea, what are the key things people would want to know? What is sleep apnea and what it can cause and why it would cause it?
Yeah, I guess some signs you get sleep apnea are you snore at night is a very common sign you may have it. You wake up tired. You're tired all the time. Blood pressure is hard to control. Those are signs you could have sleep apnea. And people who are overweight have it more commonly. So it's very, very common in the population. Right. And the treatment is you go to a sleep center, you get tested for that. If you have sleep apnea, the treatment could be either a mouthpiece for mild sleep apnea or a CPAP machine, a machine that blows air to the airways, keep it open for more moderate or severe cases of sleep apnea.
In my practice, I've come across many patients who thought that, this is how, they've accepted how they lived. For example, I've had, a couple of patients who over the years had sleep apnea and had all the features of sleep apnea, like very disturbed nightmares, snoring heavily, waking up their partners finally decided to sleep in a different room, being very tired during the days, getting, sleep, or unable to function during the middle of the day because they were sleepy. If someone has any of those features, they could have sleep apnea. So these are some things to look for or to know about. And when I interview my patients and I bring out these things in their history, they say, well, I had this for a number of years, never thought about it. And we test them for sleep apnea, and they are positive for sleep apnea once treated. Their blood pressure improves, their overall health improves in terms of their cholesterol. If they have any sort of arrhythmias, it definitely helps them to have a healthy lifestyle with treatment.
Yeah, and some people are reluctant to get a sleep study. They go, oh, no, I can't wear the mask, or I won't tolerate it, or it looks too weird. My mom could never tolerate it; she hated it.
Right.
But I have other patients who feel much better with it.
Right.
They use it, they get it treated, and then they feel so much better. They don't like sleeping without it. So I think it's worth getting looked into. If you have it, don't be reluctant. Give it a shot. It can make a big difference in how you feel.
Great.
Okay.
Well, thank you for your attention, and thank you for joining us today. This is Rathi from Bonsicle Cardiology, and with me I have Dr. Shakil Khan, who is my associate and partner over here at St. Francis Medical Center at Bonsicle.
Thank you.
Thank you.